Hi, I'm Dr. Stephen Sandifer at Champion Chiropractic. We are going to take and continue our series. Now, we went on our last video talking about how do we maintain our balance in life, the physical, chemical, mental, emotional, spiritual. And what this piece we're going to talk about now is the outside support, specifically about chiropractic care. Okay, so what we're going to talk about in the Chiropractic 101 is about the philosophy, science, and the art of chiropractic. So in the philosophy part of it, we were taught at Chiropractic College from the Essential Principles of Chiropractic by Dr. Strang. What he talked about and understand about is our philosophy is there is communication within the body, goes from the brain to the body and the body back up to the brain through the nervous system. There's a motor side and a sensory side. When this communication happens and our body's talking to itself, then the systems run like they're supposed to. Now, the science part of chiropractic knows that the brain and the spinal cord and the nerves go out and they talk to the muscle glands organs, and the muscle glands organs go back and talk to the brain on there to figure out what needs to have happen on here. But this system is so delicate that it needs protection. So we have the skull to protect the brain, and the spinal cord is protected by the spine. But the spine also has a job to get motion. So we want protection, we want motion. So the vertebrae is made up in the interlocking and protective way, but it has to have movement. So each spine has joints that allow movement. Now, there's 1, 2, 3, 4, 5, 6 different joints per vertebrae, and there's 26 movable vertebrae. That equals 156 movable parts in 3 different planes of the body. With motion and position, we want to take and make sure that any traumas or activities of daily life that are texting and driving and computeritis that we do, we want to make sure that we have the spinal function, because if there is irritation, malposition, and dysfunction, the irritation to the nerve on here, it's going to change these frequencies. And the frequency change is going to take and interrupt what the systems of the body communicate. So one of the differences between what I do and maybe what another chiropractor does is cranial work. Now, cranial work is done so that the plates of the spine move. And they move when you breathe and when you walk on there. So one of the things I'll do is get right at these occipital fibers on both sides, and they're numbered so that I can take and figure out how things have gone and how to correct on there. But these cranial sutures or joints on there, they are not as movable as the spine, but they are movable. The down the center suture joint is like a zipper, and it will move up and down like this. On the ear part of it, it moves like a scissor, and it'll move up and down. So we take and look at balancing out the cranium and the pelvis. They work together. So how does a chiropractor detect and correct spinal and cranial problems on there? Well, one of the ways is we use our hand tools, and basically what we're doing there is we are seeing if the joint spring is open and functioning or if it's stuck and closed on there. As you move your finger, you can move it to a certain point on there, and then you have a spring on there. It tells us that the ligament itself is open and functioning. Now with the spine having 6 joints, it can twist and get locked in there, and it doesn't move on there. And that's what I'll find and detect. So one of my tools are my hands. So the spine is more movement than the cranium, so we're going to use more movement with the drop piece. The drop piece table is like this. This is a miniature table that I use for the hand extremity and the foot extremity. So the drop piece mechanism to get quickness and speed has a cocking mechanism that's up, and then we will take and be able to use and get that speed and force and direction. We can put a little less on it, get it lighter, or we can take and put some more on it to take and get through what we need. Now that will take and correct and open up and get that joint position and motion going. Get the nervous system, Control Alt Delete. So we're going to use this on the extremities, and on the spine, like on the pelvis, we just use this and it drops like that. So another tool that I use is called the activator, and the activator is a quick movement again, and we can put on a little bit more, or we can take and do a little bit less. We can take this off and we can have a little bit harder, firmer, whatever's needed to move on there. So we talked about a lot about the joints on there, but the joints move because of the muscle system. And so when we treat, we want to take and not only get the joint functioning, but we want to balance out and get the muscle to go out of protection back into its function. So a couple ways that we do that is a roller ball. And we will get in there and actually roll out the muscle and get it to change. Or I can do some trigger point work and get it to change, or the activator itself will get that to change too. But we want to take and address the muscle system because the neuromusculoskeletal system works together. One of the last tools that I use on a regular basis is the foot leveler system. Now this system is used to take and look at to see if a dropped arch is here, and that takes and changes what happens up above. So this machine you stand on, and it takes a picture of your foot like this, and then we talk and see which arches have the problem. Then we take and have a orthotic made to take and balance you back out. So again, thank you for watching today. I'm Dr. Steven Sandifer with Champion Chiropractic Center. This was the philosophy, art, and science and how I use them to help you. For more information, you can go to our website, championchiropracticcenter.com.